So for our foundational review, number 4, we focus on visual and visual processing. We're basically going to go over the introductions towards visual and visual processing, the deficits, the evaluation and assessment process, and the interventions. So the importance of vision. The visual system is most important in the sense that it helps with learning, memory, recall, communication, spatiotemporal orientation, early warning system to pleasure or danger, and it's a visual manual and for visual manual and visual motor activities. It can rapidly convey large amounts of detailed information. It provides a processing speed we need to adapt to dynamic environments. And the 3 components of vision include sensory, cognitive, and motor. So this diagram is the hierarchy of visual perception. It all starts at the bottom where you have oculomotor control, visual fields, visual acuity, attention, alert and attending, scanning, pattern recognition, visual memory, visual cognition, and lastly, adaptation through vision. And each process should be supported by one that precedes it and cannot properly function without integration of the lower level process. The ability to use vision in daily activities requires the process to work in synergy. So this is the visual processing. Once stimulated, the process includes the rods and cones sending neural message to the occipital lobe of the brain, which processes and integrates the information and then perceives it as an image. So the green goes to this side of the brain and the blue picture goes to the other side. Populations and vision problems. There's 3 of them. It could be categorized as correctable vision impairments, uncorrectable vision impairments, and neurological based on visual dysfunction. For correctable vision impairments, the statistics are that the most common correctable vision impairment includes refractive errors, which affect approximately 42.2 million of Americans aged 40 years or older. It includes myopia, nearsightedness, hyperopia, also known as farsightedness, astigmatism, and presbyopia, which is the accommodation of the lens. And for uncorrectable vision impairments, there's about 1.5 million Americans older than age 45 years with this kind of condition. There are approximately 250,000 new cases each year. People with uncorrectable losses of visual acuity and visual fields are considered to have low vision or blindness. For neurological-based visual dysfunction, these are as a result of stroke and brain injuries. And there's specific visual deficits, which includes visual acuity, oculomotor, visual field, and visual attention or visual search. And I'm going to go over them and break it down in the next few slides. So for visual acuity, it's the ability to see visual details and color. Its difficulty includes focusing, damage to the retina, damage to optic nerve, and damage to posterior cortical processing. For oculomotor, it's the pathways controlling the eye movements and to achieve and maintain foveation of an object. It also helps provide binocular vision. These includes the summary with cranial nerve lesions in oculomotor nerve, number 3, trochlear nerve, number 4, and abducens nerve, 6. And right below the table for oculomotor nerve, it's impaired vertical eye movements, lateral diplopia for near vision tasks, dilation of pupil, and impaired accommodation, ptosis of eyelid. For trochlear nerve, impaired downward and lateral eye movements, vertical diplopia for near vision tasks and with bilateral lesion, assuming downward head tilt. For obtusance nerve, the impairment is lateral eye movements and lateral diplopia for far vision task. And here are the visual field impairment. Visual field is for external environment that can be seen when a person looks straight ahead. So the most common are as a result of stroke, which is 30 to 50% of people. So these are the visual field defects examples and how what a person can see. So this is for the central scotoma, monocular vision loss, bitemporal hemianopia, contralateral homonymous hemianopia, contralateral superior and contralateral inferior, and contralateral homonymous hemianopia. So these are the lesions, and it corresponds with the letters in this diagram right here. Visual attention or visual search is the ability to observe objects closely to discern information about their features and their relationship to oneself and other objects in the environment. Help ensure that a person is able to safely move through space and maintain orientation in space. This includes hemi-inattention and unilateral neglect. For hemi-inattention, it's spatial bias, non-lateralized attention deficits. For unilateral neglect, it's the categories such as sensory neglect, motor neglect, representational neglect, personal neglect, and spatial neglect. This is the table for scanning visual field defect versus hemi-inattention. So these are the difference between the two. For visual field, its main focus is abbreviated scanning patterns. Scanning pattern is organized. Rescanning is observed. Length of time, effort are appropriate for the task. And for hemi-inattention, its focus is more on the defect of disorganized, random scanning pattern, asymmetrical search pattern in hemispace. Scanning pattern is carried out with reduced effort and little or no rescanning. The task is completed swiftly, or if a client is aware of deficits, will take an inordinate amount of time in an attempt to compensate. So, what is low vision? It's the bilateral visual impairment that cannot be corrected by corrective lenses, medication, or surgery. Its diagnosis is based on visual acuity and visual field. It ranges from 20 to 70 visual acuity to total blindness, or a visual field constriction of 20 degrees or less. Main diagnosis could be central scotoma or homonymous or heteronomous bilateral visual field defect. So this is just the levels of visual impairment. There's moderate, severe, profound, and near total or total. As you can see, for moderate, it's best corrected visual acuity of 20 to 60. For severe, its visual acuity is less than 20 over 160, or visual field of 20 degrees or less. Profound includes visual acuity of less than 20 over 400, or visual field of 10 degrees or less. Near total, visual acuity is less than 20 over 1,000, or visual field is 5 degrees or less. And total, there's no light perception. These are the 5 major causes of visual impairment related to aging. I'm going to go over them one by one, such as age-related macular degeneration, diabetic retinopathy, glaucoma, cataracts, and uncorrected refractive errors. So for age-related macular degeneration, This is the comparison from the normal vision, and this is what a person with age-related macular degeneration could see. It's a progressive, irreversible loss of central vision caused by fibrous scarring or atrophy. There are two types. It's either wet or dry. The functional complaint for it is decreased visual acuity, central scotoma, decreased contrast sensitivity, difficulty with facial recognition and reading. For diabetic retinopathy, here's the comparison for normal vision, and it affects 40% of individuals with diabetes. It affects the small blood vessels in the retina, causing swelling or bleeding, which can lead to serious vision loss. The functional complaint is the development of scotomas, decreased contrast and color, discrimination, decreased night vision, and fluctuations in vision impacting all aspects of visual function. And here's the comparison of normal versus glaucoma stimulation. The damage to the optic nerve caused by increased intraocular pressure results in decreased peripheral vision in end stage, which impacts the visual acuity. The main complaint is the difficulty with night vision, mobility impairment in end stages of deficits in central visual field. Cataracts, it has main description of opacity or clouding of the crystalline lens of the eye. The main complaint is decreased visual acuity, decreased contrast sensitivity, difficulty with night driving, and diplopia.